Now, when I say this, except I think I took it away. When I say this, please do not hear the words "do not study," because that is not what I'm saying. But in comparing the first exam to this exam, there are not as many critical thinking questions on it. There are a lot of just what I call one-steppers. For example, the following is the pacemaker for the heart. What would your answer be?
Oh, the essay note.
The essay note. That's just straightforward, simple. You don't, you either know it or you don't. It's just, one thing that you need to know. So this exam, I think, has more straightforward ones. So I think if you really study, you can do actually well on both the lab exam and the lecture exam. The lab exam is worth 100 points. There are 50 questions, and the lecture exam is worth 100 points. And I'm going to try to review all of it today. I think we'll have time. Y'all, there's a sign-up sheet for the lab that should be going around, and on that has a sticky note that if your name is on that, according to my records, I don't have your lab for the endocrine system. So I'm just pointing that out. I would love to give you points for that, but if I don't have it, I can't give you points, and eventually it will turn into a zero, and nobody likes zeros. So, someone please tell me where the essay node is located.
In those areas.
So there's a 1 o'clock one and there's a 1:45.
Right after the heart. Can you be more specific?
Like a point,
Yes.
Superior lateral wall of the right atrium. Now, beloved students, that is a question on your lecture exam, and it's one on the lab exam that you're going to have to identify. So once again, the SA node, the sinoatrial node, which is called our pacemaker of the heart, is located in the superior lateral wall of the right atrium. And we just before y'all walked in, we had the question of what is the pacemaker of the heart? SA node. So that's two questions that are just, they're not hard. Okay, so those are things that you need to know.
Is it multiple choice?
Yes, there are, and this is so, every time, this is odd to me. There are 27 questions on number 14. I would think there'd be more on 15, but there's not. And there's 21, that's supposed to be multiple choice. On 15 and 2 true false. So I want to go back. I actually want to start here. So I'm kind of reviewing I want to make sure that you recognize and you're able to think this through as far as the cardiac cycle. And I even don't mind, and if y'all will remind me, I will bring a couple of hearts in here for the lecture exam, and you can, I don't mind if you look at it. There's no labeling on it, but if it will help you visualize what is going on, then I'm fine with that. You must know the pathway of blood through the heart. And you need to know if it's oxygenated blood or if it's deoxygenated blood. If it were oxyhemoglobin blood, what color would it be? Red. What about deoxyhemoglobin? Bluish, okay? So that's another, to me, simple, easy question that is on there. So what we have said is that cardiac muscle, by design, the way it was even built with the intercalated disc is specialized, okay? It actually is designed so that it functions as a unit. And we call that unit a functional syncytium. That is an exam question. And what I want you to recognize is that there are kind of two syncytiums going on at, I want it, no, sorry, I take pencils. I steal things, I like notepads, all kind of stuff. I'm a klepto little, that's bad. I didn't have to tell everybody. Anybody need this? Okay. So what I want you to recognize, and this is such a great example, during the cardiac cycle, so we are looking here, the atria both at the same time, they contract. And whenever the atria is contracting, what's happening down at the ventricles?
It's relaxing.
They are relaxing. And so the words we're looking at is contracting is systole, and the atria will do that at the same time. And if they are in systole, then the two ventricles are in diastole. Another thing I want to be sure and point out to you that you really need to recognize. The AV nodes, the atrioventricular nodes, they're partners too, okay? You're never gonna have the tricuspid valve open and the bicuspid valve closed. They work as a team, and I don't know that I actually really said that, okay? So when the atria contract, both AV valves are open. If the AV valves are open, then the semilunar valves are closed. This is a one-way street. Always goes in one way. So that would be occurring during atrial systole and ventricular diastole. There are a couple of questions asking you what's going on with the valves. And it's going to use these words, okay? And then when the ventricle, when they both start contracting, they're beginning systole, it's going to stimulate the papillary muscles in the ventricular wall to contract, and that pulls on those chordae tendineae. And that closes the AV valves. So during ventricular systole, AV valves are closed, semilunar valves are open. Now, on your exam, it doesn't just say AV valves. It's going to list the valves. So you've got to know that mitral and they're the same thing, that bicuspid and tricuspid are the AV valves. And you need to know that pulmonary and aortic are the semilunar valves. all of this terminology you need to know, and then you need to be able to think this. Be able to think that, okay? Good. We talked about the heart sounds and what is making the heart sounds.
The valves closed.
The valves closing. And what would be the term that we would use for an abnormal heart sound? A murmur. All of these are on your exam. Okay? And this is where it's talking about cardiac muscle and the functional syncytium. So here's where we actually got to, and this is a little, we're building upon, we're building a house. So the plumbing would be the cardiac cycle, the movement of blood, and now we want to look at the electricity, okay, the lights in our house. So there is a device that will record the electrical changes in your heart. Actually, what is happening to the myocardium during the cardiac cycle. And that record is an electrocardiogram. And you need to know that. Now, if you ask someone around my age that works in hospital setting or in some type of healthcare field, they're going to call it an EKG. If you ask younger people, they're going to say ECG. I just want to explain to you because it can be a little confusing. Back when the first devices were made, Siemens was a German medical supply company that was just top notch. And so in German, it's it's a K, car. And so that's why it's a EKG. And since those were the first ones, you know, just out of habit, I called it an EKG because I've called it that my whole life. You know, somebody younger physician, younger cardiologist, you know, they may use both or may use ECG, but you'll hear both, okay? You need to know what an electrocardiogram is and what it does, and it's a way that you can assess someone's heart's ability to conduct an impulse. So a nerve impulse is what stimulates, it's a message that stimulates the muscle to contract for the heartbeat, okay? And there are 3 waves to this EKG, okay? What I want you to look at now, before we use systole and diastole, we're going to use 2 terms that are a little different. So we have depolarization, and we have repolarization. And the way I like to describe depolarization is you're getting ready to fire, okay? You're aiming and you're getting everything ready to fire an impulse, okay? Repolarization is actually recharging. You've already fired and you're getting back enough energy to fire again. Does that kind of make sense? So the very first, and I'll show you this when I draw it. The first looks like this. And so this is the T wave. I can't believe I said T. P wave. The first one is the P wave. And it's just a little blip. So you need to know there are two questions on an EKG. The P wave is atrial depolarization. It's going to happen right before the atrial contraction. So it's kind of like the nerve impulse getting the message to the muscles, okay? That is depolarization, and that is this P wave, okay? Then you have, remember how the atria, when they contract, they go, whoosh. They're just little old weenies. I mean, look at that. That's nothing. But then you get the ventricles, whoosh. They're gonna really contract, and boy, they do. Look at that, okay? That's a big message. That's a big impulse because the muscle is much thicker. So this is a complex of 3 waves, and it's QRS. What is happening then is ventricular depolarization. So it's getting ready, it's aiming and I'm sorry, I'm military, okay? So like we do weapons, okay? Sorry. So getting ready to aim, and then it's gonna send the message to contract to the ventricles, okay? So this whole complex is seen as one thing, and it's gonna be ventricular depolarization. Well, I'm not writing very neat. What you can't see is this. After the atria fire, while this is going on, it's going to be recharging, but it's hidden from this complex. So don't think that it's not recharging. You just can't see it on the tape, on the machine, okay? So then you have the T wave, and that's when the ventricle is recharging, and that would be this wave. There, like I said, 2 questions on this, and you need to know what is actually occurring at each wave. Now, this is what a normal EKG looks like. You have the T wave here. Here's the T wave, Q, R, S, and then I did it again. This is P. I don't know the alphabet. I didn't go to kindergarten. T wave, okay? And see how normal it looks. Very rhythmic. Your heartbeat is your healthy heartbeat is rhythmic, okay? So this is a standard tape. What I want us to look at is, and this we already know, so I'm just reminding you, we already know that there are some things that can affect your heart rate. And we remember that because we went on a field trip in this class to Nakalula. And we got Jack's hamburger, cheeseburger. And we ran into that lion. And so if you have a lion that is this close to you and looking at you real hungry, your heart rate is going to go up. And so both the sympathetic and parasympathetic autonomic nervous system can impact your heart rate, okay? Some other things, of course, are physical exercise. I'm highly allergic to it, so I try not to do it because I'm very lazy. And, you know, if you're sick, different body temperature, so different things will impact the heart rate. And actually you have cardiac center with aortic, with aortic baroreceptors. But this is what I want you to know. All right, I'm gonna quit fooling with you. Now, several things on this slide that you will see again. Healthy hearts have a normal rhythm, okay? And if you put an A in front of a word that starts with a consonant, that changes the meaning to without or not. So arrhythmia is simply saying no rhythm. The thump is altered, okay? And there are several different types of arrhythmias. There are two that you'll see on your exam. One of these is on there, and I never can remember which one, but you need to know both, so that's okay. An abnormally fast heart rate is called tachycardia. Tachycardia, you need to know that. Now, I just simply need you to know the term. The qualification for tachycardia is greater than 100 beats per minute. You don't need to know that at this point in time. I simply want you to know the term, the definition. You can also have abnormally slow heartbeat, and that's going to be less than 60, and that is bradycardia. I need you to know both of those. The other concept that I want to bring to your attention, the arrhythmia, is fibrillation. Fibrillation. You can have an uncoordinated, chaotic firing from different areas in the heart. That's not normally what happens. Normally we have the cardiac conduction system that starts with the SA node and goes through to the AV node, to the right and left bundle branch, to the Purkinje fibers, all of that. But if for some reason you have an uncoordinated contraction, you can have it occurring in the atria, and that can be controlled with medication. What I need you to know is if you have ventricular fibrillation, it most often results in a flat line. It'll get real chaotic and then all of a sudden, and you know, unless you can be shocked or, you know, oftentimes that's just the, you know, okay? So you need to know that ventricular fibrillation is life-threatening, okay? Good. So several of these you need to know. We looked at the artificial pacemaker. That was the device connected to the cadaver heart, and we talked about how when your natural pacemaker just kind of wears out and does not fire consistently, then you can have that implanted and it will kind of take up the slack so that you can maintain appropriate heart rhythm. We have talked about this kind of all along. Arteries carry blood away from the ventricles of the heart. So that would be the through the aortic and the pulmonary valves. Arterioles are smaller arteries and carry blood to the capillaries. There is a question on your exam that asks you to identify the site of exchange of gases between the blood and body cells. That's exactly what it says. So it's asking you for the capillaries. Once again, straightforward, okay? Venules receive blood from capillaries and go to the veins. They're smaller veins, and then veins receive blood and carry it back to the atria of the heart. There is a difference in arteries and veins. We're just going to focus on the larger differences. Arteries are thick, they have stronger walls, and they have smooth muscle throughout, okay? Is smooth muscle voluntary or involuntary? It is involuntary. It's going to be contracting all along, helping to move the blood along in your body. Arteries transport blood under high blood pressure. That's why you would never intentionally, you wouldn't ever draw blood from arteries. You will get sprayed in the face. If in a surgery setting, the surgeon happens to nick an artery, which can happen, a small artery, you know, they've all got face shields because they're going to be sprayed in the face, okay? It gets your attention. You can quickly put a suture in it and get the hemostasis under control, and you just kind of move on, and it will repair itself. So that is why when we withdraw blood, it is from the median cubital vein. Veins are under lower pressure, okay? So that's what you really don't worry about, the layers. Arterioles are small arteries. Let's look at these two words, vasoconstriction and vasodilation. So the smooth vaso means actually vessel, so artery or vein. Vasoconstriction, you have a lumen, an opening, and if the smooth muscle contracts, it becomes smaller. Vasodilation, they relax, and so you have a larger opening. That's how you can help control blood flow, okay, with the vasoconstriction or vasodilation, okay? This is something I need you to know. This word right here. So arterioles just have little bands of smooth muscle. Right where it splits and it's going to become a capillary, we have this band of muscle. And who can tell me the definition of a sphincter? Sphincter.
Circular muscle.
It's a band of muscle that can contract or constrict, and so it can help control blood flow. Capillaries have no smooth muscle. Repeat, capillaries have no smooth muscle. The very last opportunity that you have to control blood flow in the capillaries is this precapillary sphincter. That is an exam question. Precapillary sphincter is the band of tissue that can possibly control blood flow in the capillaries. There are no bands of smooth muscle in the capillary walls. And this shows you the walls of the endothelium of the vessels are simple squamous, one layer flat cells. We want the O2 molecules and the carbon dioxide to be able to flow through those. So we don't want stratified columnar. We want one single layer of flat cells. That just makes sense, okay? So the precapillary sphincter is going to help regulate blood flow in the capillaries. And this is showing you how tissue fluid and oxygen molecules can diffuse through that single layer of flat cells. We are going to get into this much more with respiratory osmosis. I'm just going to remind you, the only time you use that term is if water is moving, the movement of H2O, the diffusion of H2O. Other than that, you use the word diffusion, okay? This will look at a whole lot more in, I didn't bring my water, more in detail with the respiratory system. But what I want you to notice, this is not on your exam, this is a teaching moment, okay? We're looking at the numeric values of pressure, okay? So here, this is red, so what do you think it has a lot of? Oxygen, okay, so right here, this little guy is 35 millimeters of mercury. Millimeters is a measurement of length, and the abbreviation is mm, and for measuring pressure, we used to use mercury, okay? And mercury, the chemical symbol is Hg. So that's what the unit of pressure is. I'm interested in the numbers. So this is 35, and this is 24. So 35 is greater than 24, so we're gonna have more movement this way because of the pressure differential. That's a fancy way of saying difference in pressure. The difference in 35 and 24, we're gonna have more movement to the tissue, okay? Now, look down here. Oh, we're getting a little purpley. So we're collecting some carbon dioxide, and we don't have as many oxygen bubbles, okay? So here, let's look. We have 16, and we have 24. So 24 is greater, so the movement is going to be into the vessel. Carbon dioxide from the tissue is going to move into the vein to be transported to the lungs, okay? And that's what I want you, when we get to respiratory, you'll see we're gonna have a very similar slide to this, and I want you to recognize why it's moving one way and when it will move the other way, okay? It's because of the difference in pressure. Good. Beat it. Go away. So now let's look at venules and veins. They have thinner walls, and they transport under low pressure, under very low pressure. This is important. I'm going to show you a slide in just a moment. They function as a blood reservoir. I'm going to explain that in just a minute. I'd also like for you to know that veins have valves. They're kind of flap-like, okay? This is what I wanted to show you. at any given point in time, where is most of the blood going to be found in your body? I know, I'm thinking, I hope my heart, but that's not the case. Actually, at any one moment in time, most of it is going to be in systemic veins, working its way back to the heart, back to the lungs to get oxygenated. That is an exam question. So that is why we say systemic veins are considered the blood reservoir. A reservoir is like a holding facility, okay? So your veins, systemic veins, hold most of the blood in your body by volume, okay? Good. Words that you need to know, terminology. We've had this before, atherosclerosis. Athero means fatty, porridge, fatty deposit. And that is when cholesterol, which one of the big four is cholesterol? Lipids and fats, okay? That collects on the inner surface of your blood vessels. Not a good thing. We want them smooth, okay? We haven't talked about this. An aneurysm is when a portion of the vessel is weakened and it actually begins bulging under just the pressure of the blood flow. Then that is called, when it actually bursts, if it should burst, it's called an aneurysm, and that's a bleeder. That's just blood going out wherever part of the body you are. I mean, it happens to be where the aneurysm is. The big problem is if it's in your brain, and your cranium is hard tissue and it does not give. So where you have pressure on fluid or blood collecting, it can destroy that area of the brain. So you actually have to go in there, open it up, and relieve the pressure, okay? This may be new to you. One of the combining vowels for veins is actually phlebo, P-H-L-E, and then B, and the combining vowel O. Someone that does venipuncture, a lab technician that does venipuncture would be called a phlebotomist. Okay, that's where you've heard that term before, but phlebitis would be inflammation of the vein. I told my morning class that I had classic, if I pulled up, I didn't say pull down, if I pulled up my pants, oh my gosh, my legs, they're nasty looking. I had varicose veins. I'm telling you what, I've done a lot of standing, a lot of walking, more talking, but I got old lady legs. Ooh, not gonna see me in a bathing suit. Not even gonna see me in shorts. But varicose veins are when the veins lose their elasticity. And I mean, check your grandmother's, okay? She'll show you your legs. I'm not showing you mine. But you lose the flexibility and the elasticity, and they actually are just, I mean, I've got one right here, just lumps and bumps. It's like, oh, it's nasty. Anyway, it is what it is. So blood pressure. What's blood pressure? It truly is the force that the blood exerts on the inner walls of whatever blood vessel, okay? That's what makes the blood flow. It's what makes it circulate all over your body. It will always move from a higher pressure to a lower pressure. We're going to look at the numeric values. The systolic systolic pressure, okay? So, you write, I don't think you can see it down there, you write blood pressure values as a ratio, as a fraction. The top number is systolic over diastolic pressure. This slide is old. It's been the last several years now that American Heart Association and the AMA has said that it needs to be 110/70, okay? Now, what does that mean? The systolic pressure is the maximum pressure during ventricular contraction, okay? So during ventricular systole, that's what we're looking at, okay? And it should be 110 for really good normal blood pressure. Now, if you're having issues with blood pressure, it's actually the diastolic that will get your physician's attention more. And if you understand what that number represents, then you can see why. The diastolic pressure represents the minimum. That means the most that your ventricles will relax, okay? So it's the minimum pressure after ventricular systole. You want your myocardium, your heart wall, to be able to completely relax so it can then recharge and fire again, okay? So if this number stays pretty high, then that has issues. It means your heart never gets to really rest and recuperate adequately. And hypertension is a definite problem as you get older. And the word, let's see, it's coming up. Well, maybe not. Okay, so high blood pressure, the term is hypertension, and hypertension is considered anything greater than 140/90. And like I said, this number will get the cardiologist and the physician's attention more than the systolic, okay? Hypertension is often called the silent killer because many people that have dramatically high blood pressure don't know it until they, stroke or something. Some people might get a headache, but a lot of people really, you don't know, okay? This big word right here is on your exam, and I'll write it up here so you can see it. Sphygmomanometer. Uh-oh, I need to change colors. Now I can't say it. Sphygmomanometer. Let's just say blood pressure cuff. But you need to know as a healthcare provider what it is. To take someone's blood pressure, you need a stethoscope to hear, and you need a sphygmomanometer to record the cuff. Now, I'm thinking, I hope that this is not the truth, But I think that most either medical assistants, I hope not nurses, don't know, not sure, but I know that I've, over the last year with my health history things going on, I've had my blood pressure taken a lot. And I only get the sphygmomanometer and the stethoscope when I say I want my real blood pressure. The machine is much quicker, but it is just not as accurate. It's just not as accurate. So I am hoping, we've got them down there, but they're so worn out now. I used to teach all my students how to take blood pressure because I want you to know how to do it. So I am hoping, surely, in the nursing program and any healthcare program, they have them so that you can practice. How many in here are comfortable taking blood pressures? So do you agree with me that to do it this way is more accurate, or do you, I mean, the machine's quick, but you know, if somebody's thinking about putting me on some meds for high blood pressure, you put that machine away and I want you to listen. You listen to what you hear, okay? And a lot of times, I guess I can be a difficult patient because it's like, you get the blood pressure cuff out. So you do need to know that word, it is on your exam. This is just showing you different sites, of course, that you can take your arterial pulse. The most common where we do it is carotid, also radial. Why do you use these two fingers and not your thumb? You've got a pulse in your thumb, so you're going to use these fingers, okay? A lot of this, this is in the weeds, way in the weeds, and I'm just not covering it. I think it's boring. So, sorry. So, if I'm not covering it, don't worry about it, okay? And this is where we talk about hypertension, the silent killer. There's sometimes the editor of the book kind of makes a big deal out of dependent blood flow for veins, and that it's only under minimal direct heart action. That means minimal from the heartbeat. There are other things that contribute to venous blood flow, and that's skeletal muscle contraction, like in your legs, vasoconstriction of the veins, valves, and breathing movements. Don't worry about that. Recall when we started this chapter, the difference in pulmonary circuit and systemic. Pulmonary circuit, of course, is going to be the route to your lungs and back, from the heart to the lungs and back to the heart. Systemic is going to be everything else, going all over arms, legs, all over your body, okay? This is just quick overview. The aorta is the largest artery, and we know that there are branches, there are portions of the aorta and then branches of the aorta. You, of course, have the ascending aorta, aortic arch, descending aorta, thoracic aorta, abdominal aorta, and then branches of those. We didn't learn, we stuck primarily around the heart proper. Anytime you see mesenteric, we'll cover this. You can mark it out on, I'm not going to ask you that on the lab exam, but when you see mesenteric, think abdominal digestive area here, okay? And then the other we did not cover. Now, gonadal artery would be taken, that may be a question on your exam, I can't remember. that would be, taking oxygenated blood to your gonads, whichever you have, testes or ovary, okay? It's the same artery. All of this we've been over, we know. This gets more into abdominal. You have the phrenic and celiac trunk. The ones that we had looked at was hepatic artery would be going to what organ? The liver, and that was going to be a bonus. What would the artery, the renal artery be going to? The kidneys, and then the splenic artery to the spleen. Those are bonuses, okay? Don't need all that. We didn't, it's not that your arms aren't important, it's just that we focus so much on the heart and torso. The subclavian artery branches and then it goes to, when it's in the axillary region, it would be renamed the axillary artery. Then when it comes on down here, the brachial artery. And then of course you would have the radial artery and the ulnar artery. You know those. I'm not asking you any of those on your lab exam, but you would know where they are just by knowing what those structures are. Okay, so we didn't get into the weeds on that. We did talk about when the abdominal aorta branches, the first branch is the common iliac artery and vein, right and left. And then when it branches again, if it goes deep in the pelvic floor, it is the internal iliac artery or vein. And then going straight on like it was, it's the external iliac artery or vein. I will ask you all of those. I'll either ask you that on the torso, or it actually is very easily laid out on Z, so that I think that either one of those. Now, during your lab exam, if you are unsure of what I am asking, raise your hand. I will help you if I can, because probably if you have a question, everybody else is going to have the same question. Please remember, I want you all to make, let's see, we had 3. I want you to all make 103. Please, because we had 3 bonus. So if I can help you, I will. You've got to put your time in, but this is very doable. I'm expecting I'm just expecting all A's. So there, have at it. Remember that after, well, I need to pull up the lab images, but once you're past the abdominal cavity, if we're asking here, it's going to be femoral. And there's a torso that on one side you can see the femoral artery and vein. I will not ask femoral artery or vein on Z. It is cut away. If I ask you a vein in the leg on Z, it is the greater saphenous vein. Do not miss it. I will ask it on Z. Okay? You do not have to say right or left because it's actually only on one side. I mean, well, I just lied. It's on both sides, but on the model, it's only on one side, okay? And then this has the venous system, and we've been over most of that. The only arm vein I'm asking is the median cubital, okay? I think we are just about, this is not on this exam, but you're going to see when we get to the digestive system, your liver is so important as far as detoxification. It breaks down so much. all medications, all illicit drugs, if you're bad, all alcohol, all of that, your liver has to break it down. So we need a rather large system to carry the waste away, okay, that we want to get out of our system, and that is in the hepatic portal system. And we'll discuss that a whole lot more with when we get into digestive system. I really think that's it. So, what I would like to do is go back over 14 so that I can reiterate what you need to study. Remember, for some reason, there are 27 questions on chapter 14 and 21 multiple choice on 15 and 2 true false. So,
Are we taking a quick break?
are we what?
Are we taking a quick break?
Yeah, we can take a quick break. I'll run, get my water and my phone so I can pull
Also,
out.
this was the pencil that was.
Oh, okay, thank you.
Just like you would.
If you haven't signed up for a lab time for the exam, please do so. And the sticky note or the people that have not turned in 39 that I can see. You got one?
Great.
Say what?
Yes, I think I'll go there tomorrow. I have an exam in the morning. We're going.
She said that's fine.
We have a test tomorrow. Libby and I do.
There's no way.
Yeah, and study.
But I'll study, but I'm gonna go live. But I really want to step out of yeah.
But he might be. I would.
I mean, yeah,
The microphone exam. We can do it. It's just viruses.
I'm kinda not worried about it.
I'm not worried about that one. Well, I do want to rewrite my but so there's like 15 questions. I think I've identified the images. So she said we have to identify which ones.
They were in the group what viruses.
We do need one that says purple, colorless, pink. I think all of the exam questions are supposed to be those things.
No, I don't know what we're taking.
It was from everything.
Like, she wanted, yeah, she wanted over here so they all say paper, and right out the chart, that way her mom would have.
Well, I don't have this one right now.
That's what I'm doing.
I don't have this one because that one is. And then this
Don't worry about it yet.
I didn't see nothing about it. And I didn't.
I'm trying to get my courage up, then I'm gonna start studying. Yeah, that's what I was thinking too.
I didn't finish them all.
They just kind of stopped over, studying just in lab real quick.
Yeah, we have a micro exam tomorrow, and we have to start with the colors. The bacteria is on the microscope. What's your name? Oh, Amaya. We're gonna be here in the morning at like 9.
Oh, okay.
I mean, that's really early.
No, I'm gonna have to come early. I have to work tomorrow.
We're gonna be here at 9, and then we have a micro test whenever we get done studying, so.
Where, wait, is this is it.
I didn't write my email, I'm sorry. I was over here trying.
I'm okay, I feel okay on the last, but it's like,
That's just for your evening class, right?
Uh-huh.
When do you want? I mean, what time do you want now? Oh, did you, I'm sorry. I'm so tired. 9:30, 10:15, and 11. The 11's gonna be like. So you can call me. I am hoping, Thursday to have a room, for you, to be in with some models in there. This lab will be open, but it usually kind of gets kind of crowded, and so if I can have a room that just y'all can kind of study in, you know what I've covered, different instructors, we make our own test out, so, I will try to have a room, I don't think 114 is available, I think Josh is in there. I'll have a sign up on the 202 lab door where you can study, okay? I hope it'll be down kind of on that wing so you can just kind of come in at will, okay? No tricks, it's gonna be very specific. I've marked a lot of things out, so I think that you can be successful. So let's go over this real quick and then I will go over on the slides, point some things out, and then if you would like, I'll go down and open the lab if you want to stay a little bit and study, because we'll try to finish early. So chapter 14, you do need to know that erythrocytes are red blood cells and that they transport oxygen. You need to know that white blood cells are called leukocytes, and they defend against diseases and pathogens, and that platelets are cell fragments that are thrombocytes and actually are involved in blood clotting. Number 1 on your exam is the definition of hematocrit. And it is the percentage of red blood cells in a blood sample. Hematocrit is the percentage of erythrocytes in a blood sample, and it should be about 45%. you need to know all of this and something about all of these. There's even a question that lists some examples of electrolytes, and you need to pick it out. If I said, albumin, fibrinogen, globulin, A, or if I said potassium, sodium, and calcium, B, which one would be the list of electrolytes? B, okay? So you need to know that the first one was plasma proteins, okay? You need to know just some basic characteristics of erythrocytes. They are biconcave disc. They do not live forever. They live about 120 days. And because they do not have a nucleus, so they have no brain, and they do not have mitochondria, so they will run out of power, okay? 120 days is about how long it will last. We've already talked about the difference in oxyhemoglobin and deoxyhemoglobin, and you must know that erythropoiesis is the formation of red blood cells. And the liver and kidneys secrete a hormone. That hormone is erythropoietin. Erythropoietin travels through the bloodstream to its target cell. What would be the target cell for red blood cell formation? Where are they produced? The red bone marrow. Never forget the definition of a hormone, because it helps you keep things straight. You know, what's going on and why is that happening, okay? It is negative feedback. There's one or two questions on anemia. Definitely you need to know that sickle cell anemia is a defective gene. Iron deficiency anemia, guess what? We don't have enough of iron. And hemolytic is toxic chemicals. Our body recycles very well. It's going to take the tired, worn out erythrocyte and break it down into parts and recycle as much as it can. That's going to occur in the liver. You need to know all of these. So there are 5 to 7 questions from this, okay? Several of them list the percentage of leukocytes, but that's not what's important. Go by the definition of what you know about it. Neutrophils, first to arrive at the site of infection. Which two are really good? Macrophages, phagocytes, that would be neutrophils and monocytes. You know that lymphocytes, there are 2 types. T cell lymphocytes actually attack directly, and B cell lymphocytes produce antibodies. Ew! Eosinophils, worms or allergic reaction. Basophils, you need to know both. It produces heparin and histamine, and what the function of that is. Heparin inhibits blood clotting, and histamine stimulates an inflammatory response. So all of these you need to know, along with diapedesis, that definition. That's the ability of the leukocytes to squeeze through the capillary wall and it's actually going to move to wherever your boo-boo is, so it can start healing, okay? We understand phagocytosis. We know that an inflammatory response is not fun, but it's actually needed for us. And positive chemotaxis is an attraction of the leukocytes to the infection site by a release of chemicals by the damaged cells. 6 terms you need to know. 1 or 2 of these are on there, and I really don't remember which one. So leukocytosis, high white blood count. Leukopenia, low white blood count. Erythrocytosis, high red blood cells. Erythropenia, low. Thrombopenia or thrombocytopenia, low thrombocytes. Thrombocytosis, high. You need to know all 6 of those, okay? Good. And then we get to platelets. There's a question about serotonin, and it asks about which cells release it. So it would be thrombocytes, and we'll talk about serotonin in just a minute. You need to know the definition of hemostasis. Hemostasis is a stoppage of bleeding. Then we're going to get to know that albumin has to do with osmotic pressure, and fibrinogen plays a very important role in coagulation. Our gases, of course, are oxygen and carbon dioxide and diatomic oxygen. Not oxygen. Nitrogen. Can you tell I'm tired of?
Which cell did you say releases melatonin?
We're going to the thrombocytes. And then here's a list of your electrolytes: sodium, potassium, calcium, magnesium, chloride, just a few that you will recognize, okay? And then we get into homeostasis. Remember, there are 3 methods. We have vascular spasm, platelet plug, and blood coagulation. Vascular spasm is where serotonin is going to come into play. Vascular spasm is where serotonin comes into play. Platelet plug is when it's exposed to the outside skin, the collagen on that, okay? And then the blood coagulation, there are 2 types. There's a couple of questions on them, and sometimes it's as simple as which type occurs within the blood vessel. Which would that be? Intrinsic. Which type occurs outside? Extrinsic, okay? There is also a question, and I have forgot to mention this, so please take note of it. There's a list of 4, and it asks you which substance is not involved in blood clotting. The list has fibrinogen, so you know that is. It has calcium, you know that is. It also has potassium, K, okay? I don't remember discussing that with y'all, but that also is one. The one that is not, that you need to pick, is albumin. Okay, so you should, by process of elimination, get it because you know albumin is a plasma protein and it's not involved with blood clotting. Okay, but in the past, some people have missed that. The major event for both of these is the activation of fibrinogen to fibrin. That happens for both. You need to please remember that let's see, here we go. For extrinsic, it's gonna be thromboplastin is the initiator, and Hagman factor for intrinsic. That is a question on there. You need to know the definition of thrombus and embolus. The difference is an embolus is a piece of the thrombus that is broken off and is traveling through the bloodstream. We've covered all these. Remember, infarction is going to be death of the tissue. And then we get to our blood typing. Recall that the word antigen actually comes from antibody generating substance, okay? And when you're looking at the type of blood, the antigen is the same as the blood type. So antigen, the little orange lollipop, is antigen A. So this is type A, and it's going to evoke a response from anti-B. Type B has the little green, it doesn't really have green arrows, has antigen B, so it will evoke anti-A antibodies. Type AB, which is rare, has both antigens and will evoke neither of the antibodies. Type O is going to have no antigens on it, and both antibodies will be stimulated. Also recall that type O is considered the universal donor. If you don't have your own blood type, you can take type O if it's an emergency situation. I'm sorry, that's a donor, universal donor. Type AB is a universal recipient, okay? And then we have the RH, which is actually antigen D. You are RH positive if you have antigen D, and you are RH negative if you lack antigen D. And by far, most of the population is RH positive. And remember the issues that you can have with an RH negative mother. There's actually not a question on there, but the RhoGAM injections. So that's everything. What I would like to do next is to quickly go over the lab images. If y'all, and you're free to go anytime you want to. I just thought that might be beneficial since the exam is coming up. And I'm gonna have to sign in, so give me just.
This one is.
No.
45%.
I need to clean my straw and my cup.
They're so hard to
I have like this like hot cleaner thing.
Oh, this one.
Yeah. So whenever I get home, I'm definitely having. I've been putting it on. I was supposed to clean it 2 days ago. I cleaned it very well. But I was very shocked. See, I had a little thing that you put up here. I like to buy on my straw too, but I have a thing that's supposed to go on it so like dust doesn't get in it. But
I'm not sure. Number 17?
it sounds gross, but I think I'm fine. I would eat grass, I would eat rocks. That was fun. Good old days.
One time, you were outside.
Okay, you actually need to know all of the heart. At one we only have 2 of these hearts, so actually at one station I'm gonna have 5 questions. Normally I just have 4, but because I want y'all to have 1 available to kind of study with, I'll put 5 on this one. So I will ask you, brachiocephalic artery. Up here, it's gonna be, I don't know why that's mislabeled. That is the right common carotid artery. Do y'all have pictures that are wrong?
What did I do?
This one's.
I just did the bottom as the.
Okay, but you got, I'm asking this as well. I'm asking up here. That's gonna be the right common carotid artery.
Yes.
Are all the pictures wrong, or is it really?
Yeah, I think so. All of those are labeled wrong.
Cause I've been studying it like that.
Yeah.
That's
Yeah.
what I have memorized it as.
I was struggling with that because we have other images, hold on, let me see, from the textbook. Let me see if I can find them in here.
So that's actually the right carotid.
So like, we kind of like work together, so we kind of, they were wrong, but just kind of work together.
I printed off one of these from the connected site, and I've got one that has the artery.
Oh, y'all, I am asking you that. And I expect the answer to be right common carotid artery. Right here's a brachiocephalic artery or trunk.
So
Please.
artery or trunk is.
Artery and trunk really are the same thing,
Okay.
okay? Yes.
Okay.
I usually just say artery. In class, we taught it artery. And then this is the left common carotid artery, and right here starts the right common carotid artery. So left common carotid, right common carotid. This is, okay, that one's right. This one is the right subclavian artery. That is the left subclavian artery.
They just stop at the trunk down there at the bottom in the textbook.
Okay.
So it's like, BC.
I'm asking it, y'all.
You want me to go get it from the lab? Is the lab unlocked? I go get one.
Go get what?
Here's this
The
one.
heart,
It's
no, I
really
mean,
that
I'm
one.
just
It's
telling
right
y'all, I'm definitely asking, and
Right.
please don't put brachio, I'll try to remind you Thursday morning. It's the right common carotid artery.
Just like BC, it's like BCS.
Wow. How am I just now seeing that?
Are you asking the right internal thoracic artery?
Am I asking the right what?
Internal thor-
No, no,
I
no.
was about to say, okay, cause that's
No.
also not.
Yeah,
okay.
Mark, yeah. I'm not asking that one.
Do y'all know Emily? Y'all know Emily that sits here? Emily? So I'll send it to Emily.
You mean that Emily?
Yeah, oh yeah, Emily don't move. I sent it to Emily, and Emily could put it, they could put it on the YouTube for you.
What did you just say that's not on there?
Right, common, carotid. I'm
Wait, the
Oh,
right,
with the internal, somewhere the
Is that
internal is labeled.
Right there.
Oh,
That little.
yeah,
No.
not doing that. Is
That
it?
one, yes, that
No,
tiny
it's not
one.
even on your sheet,
Okay.
and it won't, if it's not on that sheet, I'm not asking it. And listen to me, this is important. If I ask you something that I have told you I will not ask, please, just very politely remind me, hey, Dr. Dean, you said you weren't gonna ask that, and I'm gonna say, I did, oh, I forgot, because I never intentionally, you know, if I mark something off and I ask it, it's because I'm old enough, I've got better memory. So somebody please say, hey, you know, you said you weren't gonna ask that, and then you'll get credit. I'm not trying to trick you. I just want you to know the basics, and I am real sorry that I did not notice that this, I mean, how many times have I looked at this? A million times. That's unacceptable. Right common carotid artery. You need to know ascending arch, aortic arch, and on the back of the heart, I will ask descending aorta, okay? If I'm asking you auricles, it's gonna be real close, up to the flappy, I hate to call them flappy things, but it'll be close there. If I am asking you the chamber, I will on the card say chamber, okay? So that's gonna be one of four things, all right? Auricle would be just, I would tag it right there and I would not say chamber. If you say right atrium, I'll probably give you half credit, okay? And then, here you have the right coronary artery. Here is the left coronary artery, and then down here is the anterior interventricular artery, okay?
I'll send you a new picture.
I'm not asking brachiocephalic vein on the heart proper. I'm asking that on the torso, okay? I'll ask that on the torso and I'll show you in a minute. So pulmonary artery, right and left pulmonary artery. I will ask that on the heart model and the torso. Same thing with pulmonary veins. I will ask it on the heart and on the torso. I will ask the apex. I will ask you all four of the valves. I will ask you the chordae tendineae. I'll take a piece of floss and thread it in between there and tag it. Anywhere in here, I'm asking you the papillary muscle, and on the card, I will put the word muscle. Okay? I'm really trying to be just as fair as I can. This, you should all do well on this. I am asking the coronary sinus on the back. As a matter of fact, I'm not asking any of these except the tricuspid valve, and that's not a good representation. So don't even look at that slide.
Just don't look at that slide.
Oh.
Oh, did you just take a picture?
I was gonna mark out
Oh,
the ones.
okay.
Yes, I'm sorry.
That's okay.
Okay. Thank you.
Mm-hmm.
That's all I needed.
So, a good picture of the valve. The aortic valve, I'll try to find the heart that has this mitral valve messed up, and you can see the aortic valve, okay? But if you're not sure, call me over there, okay? Don't ask the interventricular septum. I will ask the great cardiac vein. On Z, I like the chambers are easy here. That's actually a pretty good place to ask the aortic valve and the pulmonary valve. I think this area is pretty good on Z, so in any of those I think would be fair, okay? The common iliac artery and vein, even the abdominal aorta, the inferior vena cava. I will ask you renal vein for bonus, hepatic artery or vein for bonus, and splenic, okay? Remember that here I will ask you the median cubital vein, and here I will ask you, this is the greater saphenous vein. The femoral artery and vein, I'm asking on the torso, on the thigh. Where are they? Is this all of them? Where are all the?
They're not on the one that's in Canvas, don't know why, I have no idea why.
I don't either. Cause I thought that, okay. So,
It's this one right here. That picture, that's the torso that it's gonna be on.
Yeah, I got that cut off. Like, the printer at work sucks. Cannot stand it. And I said to fit, and then I also printed them out like a different way to size or something, and it printed out worse than this. I was like, how's that? You know, so this is too thick. For some reason, it's not print out right.
I know, that's weird.
Very, very.
oh, cause I pulled up the wrong thing.
Yeah,
Here we
it's got
go,
some
sorry
good
y'all.
color. The color's awesome. So I can mark that out. That's not right, is it?
There it is.
Oh, yay, this is right.
Oh,
We were looking at the wrong one.
Good.
so I done.
Cause I was like, oh my gosh.
Let me.
Okay.
Sneak a little picture.
Wait, I'm sorry, whoa.
It's okay.
Okay.
I'm taking pictures of everything I can at this point.
This is loaded under lab modules.
Yeah.
It's there. I just pulled up the wrong one because I'm a goofball. And these are more what I'm gonna ask. Okay, this is great. This is white boy, and I really like to ask on white boy the pulmonary veins and the pulmonary arteries. Remember, I'm asking that 4 times. Each on the torso and on the heart. Please remember it's opposite. It's an exception, okay? This section right there is the right brachiocephalic vein. Right there is the left brachiocephalic vein. So this would be the left subclavian. The subclavian artery, you can't see well. I'm already asking it on the heart model that has all the fingers or the vessels, so I'm not gonna worry about that. Here, so the right common carotid and left common carotid are going to be duplicates. I'm asking it on the heart model, and I'm asking it here as well. Okay, so don't get alarmed that they're duplicates. I want you to know them in different places. This would be the internal jugular vein, left internal jugular vein. So this is really pretty, I'm gonna ask kind of all of that right in here, and I think that's a really good picture image for you to look at. This is pinky, inferior vena cava. I can do this on this one, the iliacs. The middle sacral artery, I didn't say this, I'm asking that on Z. It's just right there, real plain on Z. This does show you the superior mesenteric. I didn't have time to really go into that, so I'm gonna ask that later, so don't worry about that. This is where I'll ask the femoral artery and vein. You don't have to say right or left, but I'll ask it right here on that torso. I don't remember saying superior and inferior vena cava, but I will ask that on the heart and probably on the torso somewhere for the inferior vena cava. Okay, any questions? Yes.
Do you have a picture of Zed labeled?
I do on that old one, but I don't like it because it has so much of it labeled. But the one that I pulled up first, yes. So let's figure out where that is. Since, who's in charge? Okay, so, I'm having a Monday. Okay, so let's look, Jordan. Under lab module, I pulled that up first. So Z is under there. The one that is really the best is this one. What, oh, that's just the, okay. That one is the one I just pulled up. Apparently I've got two on there and I just now realized it. So this is the one that doesn't have Z on it. This one does have Z, but it's got so much of Z that it's just overwhelming. And there's so few things that I'm asking him on it. So this is it. What it doesn't show you that I will ask on Z, thank you for asking. The median cubital vein, I'm asking that on Z, and it's a Y, okay? And also on Z in the leg, the great saphenous vein. And here's middle sacral is not labeled. I'm asking that one because it's easy to tag, okay? Do you think any of this is unfair? We can negotiate. I think I'm trying to be very, break it down as to which models, and what. And just recognize that there will be duplicates. Now, I'm fine with going down to the lab, opening the lab up and you having the models to study, or you could study up here. I will do whichever you prefer. I'm finished as far as what I'm gonna yak about today. Yeah. Will I be here tomorrow? Yeah.
Yeah, well, the lab is tomorrow. Usually it's.
This lab will be open, and what I will do, I don't have a class in the morning. Are you coming morning or afternoon? I'll make sure that one of the heart, did y'all bring one of the hearts up? With the, okay, I will make sure one of the hearts